So nerves of upper limb. Nerves of upper limb. We will start nerves of upper limb. Okay. So it's so simple. First of all, you have to remember that there are nerves of upper limb are axillary nerve, musculocutaneous nerve, radial nerve, medial nerve, and ulnar nerve, and recurrent branch of medial nerve. These are the main nerve. Okay, main nerve. You can remember this arm, axillary, radial, medial nerve. If the now First of all, you have to remember that there are main nerve are auxiliary, musculocutaneous, radial, medial, and ulnar nerve. Okay, and recurrent branch of medial nerve. Other are also nerve, but that are not important. Okay, but they are just supplied to single muscle. Now, auxiliary nerve supply to deltoid muscle. Supply to the deltoid muscle. Musculocutaneous nerve supply to the to the brachium, coracobrachialis, brachialis, and BBC. Actually, BBC they supply to the brachioradialis, to to brachium, coracobrachialis. Okay, uh, to arm muscle, to anterior arm, to anterior muscle of the arm. Okay, and the radial nerve supply to all posterior muscle of the arm and arm and the forearm. Medial nerve supply to the forearm, to the muscle of the forearm, and also some muscle of the hand. Ulnar nerve supply to the most of the hand muscle. Okay, you have to just remember this. Now another thing, now see here that this is the auxiliary nerve. Auxiliary nerve come here and supply to the deltoid muscle. This is the radial nerve. Nerve move posterior to the humerus and supply to the posterior muscle of the fore. This is the arm. This is the arm, and this is the forearm. To the posterior side of the posterior muscle of the arm and forearm. This is the ulnar nerve. Ulnar nerve arrives to a medial side and there goes here and supply to the muscle of the hand. Okay. This is the musculocutaneous nerve is musculocutaneous. Musculocutaneous arise from the lateral cord and supply to the forearm, to the arm anterior side of the anterior muscle of the arm. And this is the medial nerve. Medial nerve come here and supply to the fore, forearm of anterior side of the forearm. This is simply just like this. Okay, now we will discuss that how these nerves are arise and not now. So first of all these nerves are arise from the, you have to simply remember that all nerve all nerve are arises from the C5, from the roots. These all nerve arise from the spinal cord or from the spinal cord are okay, from the C5, C6, C5, C6, C7, C8, and T1. Okay, they arise from this area, and this is called brachial plexus. So we will tell about now. We will tell all about the brachial plexus. Okay, that what is brachial plexus and what is not brachial plexus. Okay, now first of all, these are the root you have in the brachial plexus. This is the brachial plexus. Brachial plexus. In brachial plexus, you have to understand. In the brachial plexus, you have to understand that there are roots, trunk. You have to understand. You have to understand that root are RTDC. You have to understand this. So in the brachial plexus, there are the roots that the nerve arise from this. So you have to write these things. Okay. After that, you have to combine C5 and C8, and then C8 and T1. You combine this and move ahead. So this is trunk. This is the superior trunk and this is the inferior trunk. And between them, this is the middle trunk. Now after this, the division come. After this, the divisions come. Division. And this is superior trunk. From superior trunk, there is the anterior division, and one is from the middle trunk. There's also anterior division. They come here, okay, and they form. This is the anterior division. This is also the anterior division, okay, and from this area the anterior division move and form a chord. Now this is the divisions, okay, and now here are also the posterior division. This is the posterior division. Posterior division from the superior trunk, posterior division from the middle trunk, posterior division from the inferior trunk. They combine and they form a posterior cord. This is the posterior cord, okay, and this is the lateral cord. We will see why this is called lateral cord, and this is actually medial cord. This is actually medial medial cord, okay. This is actually medial cord. Now after this I have discussed this. Now what you have to see, you have to understand what you have to understand. Now from the lateral cord and from the posterior cord, when posterior cord move, they form the radial nerve. When they move, they form the radial nerve and one musculocutaneous radial nerve, and another. Now lateral cord goes on and form musculocutaneous nerve, okay. The medial cord, now you have to understand that there are also the medial nerve. We have discussed the musculocutaneous nerve, radial nerve. Two main nerves are discussed, okay. Now from the medial cord there are one medial branch. This is the branch with the medial or medial cord, and one branch from the lateral cord. They move here and they combine and they form a nerve that is called median nerve, okay. They form the median nerve. They both combine and they form a median nerve. Another is the posterior cord is the radial, okay. Another is the medial cord move ahead and they form another nerve that is called ulnar nerve. That is from ulnar nerve. Musculocutaneous nerve, radial nerve, median nerve, ulnar nerve. These four nerves are completed. Now what nerve are remain we will discuss, okay. Another nerve is the auxiliary nerve, okay. So auxiliary nerve arise from the auxiliary nerve arise. This is the auxiliary nerve arise from the posterior cord. So the main nerve are, we have write all the main nerve that is important, okay. So these are the main nerve, auxiliary nerve. Now we will go deep and find all the nerves that is present, okay. So you have to understand here. Now just I have now you have again here are from the trunk. You have to understand these all nerves are arise from the cord, okay, from the cord. But now we have to tell that from the root which nerve arise. From the root, one nerve is from the root that is called dorsal scapular nerve, okay. And one is the branch of the phrenic nerve arise from the upper root and also from the C5, okay. You have to understand this. Another is from the superior cord. There is called the lateral. There is called subscapular nerve. Sub subscapular nerve. Okay. Another nerve is the subscapular nerve. Subscapular arise from this area, and another is also subclavius. Nerve to subclavius. Nerve to subclavius also arise from the superior trunk. Now you have up to this you can remember this simply. It's so okay. Now we will just add little bit information, but that if you can't remember that, it's not so much important, okay. But this is so much important, you have to remember this, okay. Now from the trunk we have another thing is from the root, from C5, C6 and C7. From this root, the long thoracic nerve are arises from this area. Okay. Now from this area, these nerve are arise. Now from the end, from the division, there is no nerve arise. Now from the card, you have to understand which nerves are arise. From the medial, there is you have, along with the medial, you have to understand that M M M M U. From the medial card, there are many nerve arise. Okay. One is the medial cutaneous nerve of forearm, medial cutaneous nerve of arm, medial cutaneous nerve of forearm. Okay. Medial pectoral, and another is the medial medial pectoral nerve. You have to answer that from the medial there are nerve arises 4M and 1U. 4M mean that medial pectoral nerve, medial cutaneous nerve of forearm, medial cutaneous nerve of arm, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, and medial branch of median nerve. So this mnemonic you can write it with the medial card. And with the lateral card, you have to remember this L, M, L, MLM. Okay. And what this mean? ML. No, we write it. Let ML. Okay, it's okay. Uh, so write it the M L M L L M L. So from this area you can understand it's from the lateral card. There are three nerve arise. One nerve is the lateral card of the median nerve, and another is the lateral pectoral nerve, and another is the musculocutaneous nerve. So these three nerve arise from the lateral card. What? L M L. What it means? It means that first is the lateral pectoral nerve, and another is from the another arise from it and form a lateral card of the median nerve. One branch and form lateral card. This is the branch from the lateral card. So lateral branch of the median nerve. Another is the musculocutaneous. So lateral pectoral nerve, musculocutaneous nerve, and lateral card of median nerve. Okay. Now from the cord, this nerve, and from the posterior cord, what nerve are arise from the posterior cord? So to remember this, you have to understand that thoraco dorsal nerve. Okay. Now from the posterior cord, you have to understand that there are also three nerves. One is the superior and one is the inferior. Superior subscapular nerve and inferior subscapular nerve, and another is the thoraco dorsal nerve. You have to remember this. Thoraco dorsal nerve is arise from the posterior cord. Okay, it's so easy. Superior subscapular, inferior subscapular nerve, and thoraco dorsal nerve. These arise from the posterior cord. Okay, and also axillary nerve, radial nerve. These have we already have discussed. Okay. So the all the nerves are discussed in this video with you. Okay, now no nerves are remaining here. Okay, so after this we will discuss another thing that is very important. So you have to remember this and draw this chart very much again and again. Now we will tell that why it is called lateral card or medial card, etc. Okay, so about this we discuss something. Let's wait for it. So this is actually the root C5, C6, C5, C6, C7, C8, T1. So this is actually present in the axilla. Okay, so they come here and there is dorsal scapular nerve, and this is the long thoracic nerve. Okay, now this is the this is actually superior cord, this is the medial cord, and this is the inferior cord. Okay, so from this area the branches come go on. This is the anterior, this is actually the anterior division of the superior cord, this is the anterior division of the middle cord, and this is the anterior division of the inferior cord. So you can see it, you can see it. Okay, this is the anterior division of the superior cord and the middle cord, and they form a nerve, and this nerve is called what, they form a cord, this is called lateral cord, because this is the auxiliary artery, and in the auxiliary artery they are to the lateral side, and this is called, this is medial, this is the medial cord because it is medial to the auxiliary artery, and posterior side there is called posterior cord because it is posterior to the cord, and this posterior have branch from all nerve, from all cord, from the superior, from all root, from all trunk, superior trunk this is branch come, and from the middle trunk this branches come, and from the inferior cord this branch come, so it got all the branches. Okay, radial nerve, now this move past posteriorly and form a radial nerve and radial nerve. Okay, we other things are already we have discussed. Okay, so this is simple explanation with you, and you can know about this, that all the nerves we have discussed it. Okay, and their blood and their muscles etc, we will discuss that in the next video. Okay, or in this video. So this is about the nerve and which muscle are supplied by this, we will explain it. Okay, so thanks.